Let us go ahead with the exam system. Let us start with Dr. ANANTH Gowda, who will be talking about the Zyoptix.
Good morning, everyone. Thank you, KP sir and AWS for giving this opportunity. I finished my PG in 2007. No one taught us actually what is this wavefront. There was a confusion. I think Sri Ganesh sir was doing good number of Zyoptix that time. My boss Sundaramurthy was doing good amount of Zyoptix that time. So many centers were doing. We never understood what is this customization, what is optimization. So for a non-refractive surgeon or a new beginner, I've made a presentation in a very simple way how my Zyoptix has worked with me for last 15 years. This is the number which has been done at Lotus, around 30,000 procedures with 217, the earlier version. And this 32,000 procedures I have done since 2009 till date now, 217P. This number itself tells that we have been happy with wavefront customized treatments. Out of this, 75% were customized treatment, rest of the things were just a plain LASIK done. This wavefront technology came when NASA people started discovering the entity called as wavefront, and this transparent media has also got something called as aberrations, which we started calculating in terms of Zernike's polymers. We were able to measure and calculate, and we started treating it. Then the concept of customization came into the role. If you look back to the LASIK patients way back in 98 to 2004 or 2005, the main side effect, if you Google also, or the patients who undergone LASIK, the main complaints were they would complain of starburst, glare, all those, what and all, which we never see today. And the most important complication during those times was reduction in the contrast. These two were very well explained by the aberrations. These things happen because of the trefoil and the coma, and the reduction in the contrast is always because of the spherical aberrations. With the wavefront technology, we are able to take care of this coma and the spherical aberrations. Normally, whenever this cornea undergoes LASIK correction, whatever the asphericity, which in terms of Q value or the sphericity, this Q should remain around less of the negative side and the spherical ablation on the slightly on the positive side. We never want a spherical aberration to increase. The more amount of spherical aberration increased, again, the contrast, all the quality of the vision reduced. If you do a plano scan, all these, the Q value tends to the positive side, spherical aberrations also push to the positive side. So we need to control on these factors so the wavefront comes into action. Here comes my machine Zyoptix PTA or HD, what we call. It works and gives us the better results. The added advantage with this machine is it has got iris recognition also, which is specific for each eye, which helps us to have a better and safe results. If you see here, whenever we do customized result, it takes care of the pre-existing aberrations. By decoupling effect, whenever we are treating a sphere, there could be induction of spherical aberration. That is also taken care by this customized treatment. This chart explains everything here. You can see, the pointer is not there. The trefoil and the spherical aberrations are well controlled with Zyoptix. Now I think I request Dr. Amrish also to comment, because I think he has upgraded his machine to 317. We have not yet upgraded. There are so many differences. Means with 217 it was 100 hertz machine, now it's 500. The beam, we had the 2+1 combination here for spherical and aberration. It is just one, and it's again truncated Gaussian beam. Ours was a open system, 217. I think 317 is a closed system. I'm not experienced to it. And the tracking system was increased from 240 to 1740. This is the summary. Amrish sir, I think your inputs regarding this.
So now this new system basically has a high tracking speed, one thing, and a truly aspheric treatment, what you can do. The added advantage with this new system is you can do this TPRK treatment, what you were discussing, and along with PRK, means one-step PRK procedure, along with PTK and PRK in one step. So, and the added advantage with this platform is the supra-core refined treatment, what you can expect in this kind of these Zyoptix 317M2 platforms.
Thank you so much.